Time now to go in depth on this Monday, and today we're talking about your eyesight. Most of us need some kind of vision correction, whether with glasses, contact lenses, or corrective, maybe LASIK surgery. But doctors say those options generally don't completely perfect your eyesight. Even with LASIK, they say there's going to be some kind of near or farsightedness. But all that apparently changing with a new procedure that promises full vision restoration. Baines Brown's medical expert, Dr. Randy Shuck, sat down with a local eye surgeon for more details.
Joining me now is Dr. Steve Updegraff. He's a local physician that does a lot of eye work, an ophthalmic physician. So I asked you here today because there was a kind of something that caught my eye the other day, no pun intended. I had a patient I sent to you who didn't really have any cataracts or anything else, but was wanting to have some better vision. And so you offered him a newer procedure. And I was hoping that you could tell us a little bit about that. He didn't have any major issues in the background. He just wanted to look to see better.
Sure. He had a unique situation in that he couldn't see distance, intermediate, or up close. And he was in his 50s. And he was interested in LASIK, but he really wanted to have all three. And most 50-year-olds want all three. And so the only technology that could really help him would be a lens implant that is designed to focus light from distance, intermediate, and near, and that's what he had. He's a good candidate for it because he was farsighted or hyperopic.
Okay. So someone like me, I'm nearsighted, so I can see close up and I do all my work close up, but I can't see far away. And so my issue is that if I fix that far away, I'll lose this up close stuff. Now, this is supposed to help me a little bit, or is that possible?
It's possible if you have a cataract, and that's an opacity of your natural lens inside your eye. Most patients over the age of 50 have some sort of deterioration or opacity of their natural lens. And that's why someone who had his prescription, it makes good sense to do a lens implant. Now, patients that are nearsighted have a longer eye instead of a short eye. So they have a propensity, not a big one, but a small propensity to develop retinal detachment. So that's why we don't recommend lens implants for patients who are nearsighted unless they already have signs of cataract. But patients who have a short eye, they don't have that risk. So using a lens implant can make a lot of sense.
Now, I know when I went to medical school, they always said that at a certain age, your eyes actually change how big they are. So is there a chance for me in the future that my eyes should change and I should have good vision, or maybe not?
Unlikely.
Oh.
The only thing that's changing is the lens inside of our eye loses its flexibility. That's the main aging change that occurs after 50. And that's why people who have perfect vision their whole life at distance all of a sudden need reading glasses, because their natural lens doesn't flex anymore and give them the magnification that they had when they were 20 and 30 years old.
So these new lenses, they act more like the original ones that we had, that God gave us, that basically will flex more, or are they not really that good?
Well, they are good. There are two types. There's an accommodating lens that plays on that function of the lens inside the eye flexing. So there are lenses that have hinges that can actually flex and move inside the eye to give you a range of vision. But they're very dependent upon that muscle moving that lens forward and back. And some people can move the lens really well and get out of reading glasses and have distance. And others, they get distance and computer vision. The multifocal lens, on the other hand, is a fixed lens, and it has rings on it. And those multiple rings are what focus light from distance, intermediate, and near. The advantage is everybody gets out of reading glasses and they have distance vision. But the disadvantage is you can have some halos and glare from those rings. So that's why sitting down and talking with your ophthalmologist and really determining what technology really fits with your lifestyle and what your expectations are is so important with this technology.
So do I have any way to make my eyes stronger, to make my lens work a little better, or am I just basically the way I am?
Well, they've tried, and there have been some, tests that are encouraging, that look like perhaps that could happen. But I think inevitably we're all going to lose that flexibility in our lens, and we haven't found any magic way to reverse that.
Okay. Now, let's say I had LASIK done previously, or I had some other stuff done. Does this make it so I can't do this procedure?
No, you can still have these high-tech lens implants. As a matter of fact, patients that I operated on 15 years ago with LASIK are now coming to see me because they've developed cataracts. And we're doing lens implants for them and using these high-tech lenses. So many of them are really thrilled that we can give them the option of seeing distance, intermediate, and near, not only just distance, which is what they got 15 years ago.
Yeah, now we just did a story on someone who had retinal burn from being out there in the sun. So I'll give you a
Yes.
few seconds to plug eye health, because I think that'd be a great thing.
Absolutely. And these lens implants actually have UV filters in them to
Really?
protect the eye. And eye protection is critical. And from the ultraviolet rays, wearing polarized lenses, I always tell patients, doesn't matter what brand, but if it has true polarized lenses, that's going to block out 99.9% of the ultraviolet light. And that's really what you need to do to prevent cataracts and all the other problems with the retina.
Yeah,
So,
especially in Florida.
Yes,
We have a few issues.
absolutely.
You think they come down with cataracts? You think we grow them here?
Both.
So just a few minutes to allow you to brag a little bit. You've been doing this a few years, and you've kind of pioneered a few things in our environment.
Sure.
You want to take a few seconds to tell us about that?
Well, you know, I'm most known for LASIK. My father's an ophthalmologist who has been doing did cataract surgery when I was growing up. So early on, a lot of people ask, why are you still doing cataract surgery when you should just, you know, you could be doing LASIK? My answer is that cataract surgery and lens implantation is a whole nother field, which now LASIK and lens implants has really merged together as really a whole new field in refractive surgery. So it's kind of melded together. So I've been doing lens implants for 20 years, I've been doing LASIK for 20 years, and now we have these great technologies that can help people see distance, intermediate, and near, and we can combine LASIK to actually fine-tune after a lens implant too, which we're doing on a regular basis.
Exciting stuff.
It's
great
great
for us
stuff.
getting older, unfortunately.
That's
thanks,
right.
Thanks a lot for joining
Thank
us
you.
today.
Appreciate it. Thank you.
Now, if you're interested in this option, it's important to visit an eye surgeon to fully explore all vision correction plans to see which one may be right for you. We've posted more on this procedure on our website. Just go to baynews9.com and click on the Scene on 9. And that does it for this Monday's In Depth.